Hi, I'm Dr. Christine Horner, and today I'm going to be speaking about current trends in thermography interpretation. So I'm a former surgeon and actually ended up leaving my practice because everything that I was working on I saw was preventable. And since that time, I've probably spent 20 years now writing books and really focused on helping people to achieve extraordinary health and longevity. My first book was on breast cancer prevention using through diet and lifestyle and a supplement approach. And my second book is on how to create extraordinary health and longevity. So I got very interested in thermography when I was first introduced to it because I saw that it was really a very powerful preventative tool. And in fact, it was something that helped people to engage in their health. So this is a problem. Most doctors, realize that getting people to change their diet and lifestyle is actually a very difficult thing. And with thermography, we find that it really helps people to stay motivated and make those changes. So I first started in thermography. I was very interested in breast thermography. Used to be a breast surgeon, and as you know, have a special interest in breast cancer prevention. And as everybody knows, we can see increased vascular patterns that would be associated with an increased risk of developing breast cancer at some point in the future. So what I did was I actually developed a supplement called Protective Breast Formula. I also recommend a number of other specific nutritional supplements as well as diet and lifestyle. And we identified women that had an increased risk with multiple patterns, put them on the diet and lifestyle and the supplements. And I thought, well, maybe they'll take the supplements, and I'm not so sure what they'll do with their diet and lifestyle. And then rescanned them in 3 months. And the results were absolutely jaw-dropping as far as the reversals of the patterns that we were seeing. So it was this great visual for women to be able to see how they looked before, how they looked after they made those changes, and what an impact that made on their health. And the thermographers I worked with said, I said, oh, well, I'm sure they're taking the supplement, but I'm not sure about their diet and lifestyle changes. And they were like, oh, no. When they saw that, it was incredibly motivating for them, and they were all making these diet and lifestyle changes. So human beings are visual, and so that's why I think this is a very unique tool that can help people to really stay motivated on a diet and lifestyle changes that can make a huge difference in their life. Now I'm thinking, what can we use as far as findings on a general, thermography scan that, not using breast, but just, a general thermography scan that would be an indication of overall health that we could monitor, show patients that they have it, and then monitor it that can, act as this kind of motivating factor for them. And so the main thing that I thought of, initially was inflammation. So as most people know, inflammation is something that we know is a huge factor in the initiation and progression, really driving all chronic diseases. So, from Alzheimer's, dementia, heart disease, diabetes, and obesity, and all sorts of different kinds of cancers, particularly breast, prostate, and colon cancers, inflammation plays this huge role. So if we find evidence that somebody that is in this extreme inflammatory state, that's going to put them at risk for all those different chronic diseases that we see so commonly in the American culture, right now. Now the question is that when we're looking at thermal modeling, is that actually systemic inflammation? I mean, what is it? So when I was being trained as an interpreter, I was taught, okay, with thermal modeling, this is a non-specific response that the body produces, or shows up in thermography. And there can be all sorts of different reasons why someone would have thermal modeling. So I was like, okay, well, let me take a look at that and see what's the evidence in the medical research as far as what thermal modeling is. I also looked at just the regular internet, to see what thermographers on their sites are saying thermal modeling represents. So as you can see, there's lots of different things that potentially can cause thermal modeling, and what I found was that some of these things have absolutely great evidence with it. We know that they're true, and other things, there's no evidence for it, and it may be that somebody just made that up. So first of all, alcohol. Now, we always say people shouldn't drink before the night of the scan, because if they do, it can show up as thermal modeling. Well, here's a very interesting pictures of a man that actually is a thermographer in Norway. And he did this experiment on himself where he took a picture of himself in normal state. And then he decided to drink excessively all different kinds of alcohol, which I wouldn't recommend, but the next day he took an image of himself, and that's what the difference was. So clearly, alcohol is something that causes thermal modeling, and we know alcohol causes inflammation. It also increases or opens up the intestinal permeability, so it can be, as a part of leaky gut, and also maybe lymphatic congestion. Smoking, I mean, everybody's seen scans of people that are actively smoking, and there's thermal modeling associated with that. Chemotherapy, various different toxicities and allergies. Stress is interesting because that plays a huge role in every kind of chronic disease, and we know that it increases acidity in the body and causes all sorts of detrimental physiological effects. So we would expect that that would show up as modeling, but there's no research that shows that correlation in medical research. Various different infections, of course, systemic inflammation, autoimmune diseases. There's actually 147 different autoimmune diseases that have been identified. Most of them have leaky gut associated with them. But as you might have noticed on your scans, then people with a variety of different autoimmune diseases generally have modeling signs that are there as well. Inflammatory bowel disease and leaky gut disease. So these actually have good correlation, and we can see modeling patterns sometimes that are actually just isolated to the abdomen versus including other areas of the body. Lymphatic congestion. Now, when we get to hormone imbalances, this one's really interesting because, again, when I was being trained, I was taught that the thermal modeling that it could represent estrogen dominance. So that didn't ring true for me when I first heard that, and I was like, well, where's the research? Like, show me the research. And as it turns out, there is absolutely no research on that. So I went through the medical research, and I put in a variety of different search terms, not just the one that's up there, but different combinations, of different words there, to see if I could get any studies that would show up about modeling patterns on thermography and what they were correlated to. And there was basically nothing that was showing up with that. I mean, I had like 3 studies, and none of them are, anything that really indicates systemic issues. And then I was like, okay, estrogen dominance. So now I'm going to put that in there, and various different combinations of words, many different searches with it. And every single time I did that, always exactly the same result, which was no results found. There's no studies that have ever been done documenting that modeling patterns are associated with estrogen dominance. I mean, zero science. So for me, we need to take that out of our vocabulary and not include that as a possibility when we see modeling patterns. Now, it's possible that that could be there, but there's been no studies on it. So to me, it seems like, okay, there's so much call to action here as far as people being involved in doing studies so that we can get this information. And this might be a very simple study that could be done in an OBGYN's office who's doing hormone testing and then can be doing thermal imaging at the same time to see if there's any association. It's not quite as easy as you would think because there's actual fluctuations in hormones throughout the day and throughout the night. And so you actually have to kind of hit it, at the right time. But at least we could find people that were extremely estrogen dominant and then correlate it with a thermography scan, but at this point in time, that's not been done. Now, I was actually looking outside of PubMed too, because sometimes you can find things on Google, Scholar, where you can find scientific research papers on there. And so I did find a really interesting study, serendipitously. I live in San Diego, and this was done here in San Diego. There's an institute here that does a lot of research on subtle energy devices, and they're pretty, famous. So their head researcher was involved in this book that was written called Earthing, and it was the kind of topic of it was that we are designed as human beings to actually walk barefoot on the earth. And when we do that, we actually discharge these electrons into the earth, and it causes inflammation in our bodies to decrease. So when we're not in contact with the earth, we're wearing rubber-soled shoes or in buildings all the time. That's one of the things that's contributing to inflammation in our bodies. So this is something that's been researched, proven, and in fact that is true. And so what they did in this study was set up pretty well, where they did a randomized double-blinded pilot study, and they took thermal scans of people before they had any treatments. We call it earthing or grounding. And then they did an hour treatment with either that they were actually getting the earthing. They used different wires and so forth to ground people to create the same effect. They didn't have them walking outside on bare feet. And so they used sham ones, and then they used the real ones. So they were able to do it as this double-blinded study. And so here is an example of a patient. On the left is before she had the treatment done, and on the right is after 1 hour of having had that earthing or grounding treatment done. And you can see that a lot of the modeling patterns that we see on the left have resolved on the right and decreased significantly. So to me, it was like, okay, there's evidence that modeling patterns really are associated with inflammation. But I'm telling you, there's not a lot of documentation out there. Now, with digestive issues, I just have noticed as an interpreter that when the history of the patient says that they have a lot of problems with bloating and gas and discomfort, cramping, that kind of thing, or if they've had actual diagnoses of GERD or inflammatory bowel disease like ulcerative colitis or Crohn's disease, leaky gut syndrome, that invariably I will see that there is modeling patterns that's over their abdomen, and sometimes it's in their whole body, but other times it may be just isolated in that location. So this particular gentleman is someone that complained of a lot of digestive issues and also had esophageal reflux. Now, amazingly, I just thought that there would be more research in the medical literature, because there is a lot of research on thermography, but there just hasn't been a lot of research in this area of looking at thermal modeling patterns. And so I found just one study, if you can believe that, on inflammatory bowel disease that also included colorectal cancers. And this was out of Croatia. But what they found is that there's definitely modeling patterns that are involved in people that have inflammatory bowel disease. On the left is an image of a person that's normal. On the right is of a woman who has active ulcerative colitis going on. And again, you can see a lot of thermal modeling there, so we know for sure that's associated with that particular problem. Now, gastroesophageal reflux disease, similarly, there's just practically no research on it. This is one that I found that I thought was particularly interesting, because what they did was to do a provocative test. So they inserted a tube into the stomach, and they flushed it out with saline, and then they dripped acid, hydrochloric acid, into the abdomen. into the stomach rather, and then when a person started having symptoms of the reflux, then they took, you know, the image. And one of the things that they pointed out that they thought was kind of fascinating was that they got a cool pattern that occurred over the chest and then a heat pattern kind of over the central area, and we do see thermal modeling with that as well. So again, I think that the way that we use thermography most commonly here in the United States is of extreme value, and in particular, you know, helping people to use it as a preventative tool and helping to motivate them to take better care of themselves. So it allows us to kind of access, you know, people, I mean, like I said, sometimes people, most of the time, they don't get motivated or even interested in taking care of their health until they get sick. And so this is a device that's really allowing us to show people, hey, there's things going on with you that you may not even realize. And when they see that, and that visual picture is something that really has a profound effect, then it allows an access where they have that motivation. We can have the opportunity to really supply them with educational information that can help them. And I always think it's important to really refer people to holistic, naturopathic, integrative type doctors that they can work with who are more focused on creating health rather than, you know, looking at specific diseases. So one of the things that I do is I offer telephone consultations for the clients that I've done their thermography interpretations. So I can go over their scans, and then I can give recommendations to them, you know, as we go through. So, you know, you've got sinus issues, or you've got, you know, teeth issues. You need to talk, you know, to your dentist the next time you see them. If you've got TMJ, then you want to, you know, talk to your dentist again and see if your bite's off, if you're grinding your teeth, and you might need to have a bite guard, you know, made, and kind of go through the systems that way. And then if I, you know, get to a patient that's really having a lot of issues with modeling patterns like that, or leaky gut, you know, syndrome or whatever, then I talk to them very specifically about that. And I realized that, boy, it would really help them if I were to write, you know, a document up on the most common topics that I see that people are having as issues, and you know, talking about, you know, what it is, what are you doing that's, you know, contributing to it, what are the things that you can do to help to heal yourself from that, you know, that's something that's would be, you know, really needed. And so I've written 3 documents, and I sent them to the IAMT, so it's on their website, and they did a wonderful thing where they took my document and put it into this beautiful format of a brochure in a PDF. And so the design of it is that their clients or patients, the thermographers actually can download the PDFs and then electronically give them to their clients, or they can, you know, print them off and hand them to them. And I always, you know, at the end of my consultations, I'll, you know, send those to the people that I've talked to as well. So they've got, you know, the information. They get the motivation, you know, with it, and then really try to connect them with more holistic people that can work with them, you know, focused on improving their health. And that way, I think thermography is something that, you know, is really going to help tremendous amount of people to experience better health, you know, longer, you know, longevity, but also more joy in their life because they're not suffering with all sorts of symptoms and chronic diseases. So thank you very much, and I look forward to any questions that you want to send my way. And thanks again. Bye.